Good afternoon, friends. Thank you, Dr. RC, for calling me over and also help me to educate myself on this subject. I'm glad I came early and listened to all the brilliant talks by my other speakers. So I shall talk about low salt substitute. So how to go about substituting salt. So we know that salt is one of the most essential commodities in the world. It was called white gold. And we all use it to preserve and flavor food since ancient times. And there is a significant political, cultural, public health importance in our country. And we all know about the famous Tamil saying, Uppilla Pandam Kuppaile, for the benefit of my Bombay friends. Anything without salt has to go into garbage. That was what was originally thought about. So we all know about the Dandi March, the salt tax that was introduced. Then the double fortified salt. Tamil Nadu has been using this double fortified salt since 2004 in the midday meal scheme. And the current double fortified formulation is 100% daily required of iodine and 30 to 60% of iron requirement. But this would require consumption of something like 10 grams of salt per day. So this is the Indian story of hypertension. Dr. Narsinghan has dwelt in detail about it. Let me skip. The sodium intake in our country has been quite high. The surveys have shown that it is about nearly 11 grams per day. And somebody in Kerala has said that it's about nearly 15 grams per day of salt. And salt is added to food, and then we have the habit of adding salt to our curd rice, to our buttermilk, etc. And needless to say, the processed food and the packaged foods which contain a lot of salt. So this is the average salt consumption in India. And you look at Tamil Nadu, somebody in 2014 has said the salt consumption per day is nearly about 13.2 grams. And what are the sources of salt? You know, it's mostly added salt, 90%, more than 90% daily intake from the home cooked foods. And this is a study in 2019 where it was found out that throughout India, whether it's the northern part or the southern part, added salt adds to the salt content. Nearly the main sources of salt in South India was meat, poultry and eggs, while North India it was dairy and dairy products. So an urgent action is needed to implement a program to achieve WHO's salt reduction target of at least 30% by 2025. And the multifaceted role of salt and its detrimental effects on various organs have been discussed. Low dietary salt reduces blood pressure in hypertensive adults. Low dietary salt reduces blood pressure in normotensive adults. These are all documented facts. And a lower salt as part of a healthy diet was seen in the DASH diet. It reduced the blood pressure. As the salt reduction happened, the blood pressure reduced from about 6 to nearly 9 millimeters of mercury. In summary, a high dietary salt increases blood pressure, which is a health risk. Lower salt consumption decreases the blood pressure, and other dietary factors can also reduce the blood pressure. The importance of a low salt intake has been very clear. And let's come to the low sodium salt. Now, what is this low sodium salt? This is an opportunity to lower salt intake. So sodium is replaced by other minerals, commonly 65% sodium chloride, 25% potassium chloride and 10% magnesium chloride. Potassium chloride is the one that is commonly used because it's closely related to sodium chloride in terms of physical and functional properties. And the low sodium salt in country is sold in different brands, 15% reduced sodium. More recent ones have 30% lower sodium. And the ones that are fortified with iodine marketed as low sodium iodized salt. So what is the formulation? The sodium chloride varied from 0 to 88% and potassium chloride varied from 0 to 100%. The composition varies in different countries. In India, less than 20% sodium chloride was replaced, while in other countries, nearly 50% was replaced. So potassium, as I mentioned, potassium chloride is the most common mineral salt used to partially replace sodium chloride in salt substitutes. The major concern is the alteration in flavor and the palatability, including the metallic taste. To overcome this, lower percentage of potassium chloride was used, along with nutritionally acceptable other mineral salts like magnesium chloride, magnesium sulfate, calcium chloride, amino acids, and various spices. In studies, most individuals are unable to distinguish regular salt and salt substitutes with KCl when used not more than 30%. So there are different countries where this low sodium salt is available. Almost every country has got except areas of Africa. And if you look at South Asia, again, a lot of these substitutes are available. Then we have to look at the price. So at least in our country, the price of the low sodium salt is about 1.7 times the price of regular salt. In lower middle income countries, it can be much higher. And what is the impact of this low sodium salt on BP and cardiovascular disease? High levels of potassium associated with lower levels of blood pressure, that has been alluded to by the earlier speakers. The sodium potassium ratio is more important than either sodium or potassium alone. For the general adult population, the WHO and the ICMR recommend a daily potassium intake of at least 3,510 milligrams per day, or a sodium potassium intake ratio of less than 1 to prevent hypertension. Now, what are the benefits of this potassium enriched salt? Meta-analysis has shown that there's a significant drop in systolic and diastolic blood pressure. Seems to have a greater beneficial effects among hypertensives and may facilitate BP control with less requirement for antihypertensive medication. 3 RCTs assess these effects. However, they have shown mixed results. Now, it's very clear that the effect of the low sodium salt substitutes on blood pressure detected hypertension, stroke, and mortality. And this meta-analysis showed that systolic BP reduction was significant, diastolic BP reduction was significant, and it is very clear that this low sodium salt substitutes significantly contributed to this reduction. So this is an Indian study more recently published, 502 patients with hypertension, 7 villages in rural India. They were randomized to receive regular salt or a salt substitute that contains 70% sodium chloride, 30% potassium chloride. The primary outcome was a change in systolic BP from baseline in 3 months. At 3-month follow-up, the low sodium intervention group had a decreased systolic BP by 4.6 and a diastolic BP by 1.1. And participants also rated the taste of the study salts are similar. Direct evidence on the effects of these salts on cardiovascular events and mortality have been proved. There has definitely been a reduction in mortality with these low salt substitutes. Regarding stroke, among people with a history of stroke, more than 60 years, with poorly controlled blood pressure, when they used the salt substitutes, the reduction was very evident. So what is the safety? The greatest concern is, as a nephrologist, we are all concerned about potassium because potassium can kill immediately. The greatest concern was hyperkalemia, higher levels of intake not associated with adverse effects in patients with normal kidney function. So you're able to maintain homeostasis. As long as the kidney is fine, you excrete all the potassium out. So the prevalence of hyperkalemia in the combined general population, the high-risk cardiovascular group, was infrequent. However, there are risk factors for somebody to develop hyperkalemia. This group, we deal with chronic kidney disease, patient on ACE inhibitors or potassium-sparing diuretics, diabetes, heart failure, cardiovascular disease, adrenal insufficiency, etc. So we have to be very careful with this group of patients. And this is a study published in Hypertension very recently. So this study was done by the George Institute from Sydney, but they did it in India. So modeling nationwide salt substitution in India consistently estimated substantial net benefits, preventing around 8 to 14% of annual cardiovascular deaths. Even allowing for potential hyperkalemia risks, there were net benefits estimated for individuals even with CKD. Potential adverse effects, again, minor respiratory and GI symptoms. And these are the low salt substitutes that are available in India. I did not put up any trade names. 10, 15 or 30% of sodium replaced with potassium and iodized. These salts are safe as per FDA and sold 2 times higher the price. Probably Sapiens Foundation should help in reducing the price. The FSSA released a draft notification defining 65 to 75% reduction of sodium chloride and has an advisory statement on the label. So I picked up one of these and read. This is the recommendation given by the Food Safety Association. To be consumed under medical supervision, there is a risk of hyperkalemia on consumption of a high potassium salt when there is renal or cardiac dysfunction, diabetes, or in a case of consumption along with certain drugs that can substantially impair potassium excretion. I think there is a very significant and very pertinent warning that has been given so that people don't take it as regular salt, because at least people have to know that there are risk factors. So sodium reduction strategies, the World Health Assembly in 2013 set a global target of 30% relative reduction. More important strategies are to mass media campaigns, increase uptake of the low salt substitutes. And if you look at the major causes, sodium from packaged food, sodium from food prepared outside the home, these are the biggest offenders. So what are the challenges we have? One is the limited availability, low awareness, higher price, concerns about taste, low demand and higher cost. Other salts like the Himalayan salt, black salt and sea salt have growing popularity, but these are non-iodized, and sodium similar to regular common salt with other minerals. We have our patients who come and ask us what salt can we take. Very common in the nephrology OP. The research gaps and barriers to be addressed. Impact of low sodium salts with different proportions of potassium and hyperkalemia among high-risk groups have to be studied. Manufacturing and technology gaps, potassium chloride availability, effect and cost of subsidies that can be offered, feasibility and impact of including these low salt substitutes in public programs like midday meal scheme, and feasibility of multi-fortified LSS given the recent interest in the double fortified salt, the iodine and iron. So let us say control salt and delete. So thank you very much for the opportunity.